Now, I was asked to moderate a plenary panel, and as part of my panel, I would like to invite the leads for um, the tracks. We have the product development track, we have the market shaping track, we also have the regulatory track, and the uh, product development, market shaping, regulatory. What's the fourth one? Investment track.
It's my pleasure to attend the TAMC for the first time since its inception, and I'm certainly quite privileged to have the opportunity to share the reports on some of the work that we have been doing on the regulatory track together with the Vilgro Africa and other stakeholders over the last year, even though I did not attend last year's conference. And so I stand here also to represent some of the collaborators that we have worked with, including Vilgro Africa and Dr. Robert Karanja, whom we have also worked with closely. I'm going to report on our regulatory sandbox project that we undertook last year as a project meant to promote the regulatory agenda within this broader project on promoting innovation within the health sector. Now, the regulatory sandbox modeling project is a project that was sponsored by Vilgro Africa under the East African Biosciences Studio Fellowship, which my team and I participated in. And it was conceptualized with the appreciation of the fact that legal, policy, and regulatory frameworks play quite an important role in mediating the introduction of new technologies in society and in specific economic sectors, especially the health sector. And zeroing in on regulation, we appreciated that stringent regulations can protect the public, sometimes inadvertently undermining innovation. On the other hand, lax regulation can promote innovation by providing space to innovators, but can also inadvertently undermine public health and other public interest. Optimal regulatory frameworks, on the other hand, can indeed promote both innovation and protect the public interest. And so the regulatory sandbox modeling project that we undertook in 2024 to promote this agenda of an optimal regulatory environment for health technologies involved stakeholder consultations within the Kenyan health sector. We spoke with the innovators, regulators, policymakers, industry associations, and many other relevant stakeholders within the health technology space to understand what it would take for this innovation ecosystem to work together in imagining and modeling an optimal regulatory environment. And so the key underpinning framework that we sought to explore here was, of course, the regulatory sandbox, which is defined as a tool for developing evidence about how a new product, technology, or business model works and the outcomes it produces as a controlled, time-bound, live testing environment, which may feature regulatory waivers at regulators' discretion. And from speaking with the stakeholders across Kenya's health sector, we indeed appreciated that there is an opportunity for the innovation ecosystem to work together in ways that address the particular barriers that are recognized to be predominantly regulatory barriers that are perhaps impeding innovations from making their way into the market. And so, in brief, As part of this project, we engaged in stakeholder consultations that led to us shortlisting a couple of regulatory issues that regulators and innovators pinpointed as needing or attention, problematic issues needing attention, and that perhaps could be addressed via a regulatory sandbox. That included, for example, on the part of the regulators, the fact that the regulatory environment is outdated when it is applied to new technologies that have not been anticipated when these regulatory frameworks were being put together. This includes, for example, artificial intelligence diagnostics tools that have not yet been properly taken into account. Secondly, there is a problem of insufficient regulatory resources on the part of the regulators, where they then do not have sufficient capacity to be able to keep up to speed with market developments in these regulatory, or rather in these innovation developments. When it comes to the innovators, they also pinpointed similar challenges that the regulators pinpointed, including the outdated regulatory environment, onerous regulatory requirements on the part of the innovators, the fact that in certain instances, in some countries in Eastern Africa, there is a fragmented regulatory environment, which means that innovators have to go through many regulators to get regulatory approvals that in many instances leads to duplicatory efforts in indeed submitting the same information to multiple regulators. The fact that the regulators themselves do not work together despite being despite looking at the same applications and information that is provided by the innovators. An important problem was, of course, constrained access to health data because of the challenge of regulating health data, which is a challenge that, of course, our policymakers are grappling with and having a conversation on how to resolve, so as to ensure that we are protecting citizens' data, we are protecting personal data, but at the same time providing sufficient access to innovators, researchers, etc., to promote innovation. And of course, lastly, was also constrained access to funding. Having said that, we also, in these conversations, appreciated that a regulatory sandbox can therefore resolve quite a bit of these challenges that we were able to glean from our consultations with stakeholders in the health sector. So just to go back, regulatory sandboxes can benefit innovators to the extent that they provide supportive environments for safely testing new technologies, since the innovators are getting guidance from the regulators on good approaches to, for example, sufficient evidence to undergo clinical trials, and of course, insights on how to comply with the regulatory requirements that in many instances are difficult to understand, and in certain instances even outdated. For the regulators, we also appreciated that they benefit from regulatory sandbox programs because they provide structured mechanisms for systematic testing and analysis and enhancing feedback and communication channels between innovators and regulators in ways that promote knowledge transfer, enabling the regulators to understand the innovations that are being introduced into the market and therefore to be in a best placed position to regulate optimally in ways that do not undermine either public interest or the interests of the innovators on the other hand. And of course, it helps the innovators to then be able to review the regulatory policies and frameworks and enact frameworks that promote innovation and protect public interest. And of course, for the patients, we also appreciated that regulatory sandboxes can help in providing earlier access to innovative technologies because these innovators are working in tandem with the regulators, therefore removing these barriers between the ideational stage and the market entry stage, enabling, again, these technologies and innovations to get to the hands of the medical professionals and promote patient interests. And importantly, they provide better evidence and assurances of safety and effectiveness of these products because at the end of the day, as our speakers have said, we look to ensure that we are actually innovating for the interest of the broader public rather than merely making profit. So in short, this is a conversation that has led to a buy-in by the policymakers, for example, from the Ministry of Health. We are grateful for the support that the Office of the Director General of Health in supporting this project and even enabling us to start collaborating with the Clinical Trials Technical Working Group under the Ministry of Health to see how a regulatory sandbox can actually promote clinical trials frameworks. Secondly, we were also quite privileged to get the buy-in from the Parliamentary Health Committee that we also engaged with in this, and they actually said that they're willing to support this particular project by looking at how the legislation that come before them relating to health agencies can actually give our health regulators the relevant regulatory mandates to establish and run regulatory sandboxes for health technologies. And of course, quite importantly, this has also provided an opportunity for innovators, regulators, policymakers, and other stakeholders to continue with this conversation on how we can actually establish a regulatory sandbox in Kenya's health sector, as we have seen in other economic sectors in Kenya, including the ICT sector, the capital markets sector, and of course, the insurance sector. I will stop here and I'd be happy to engage with this particular report during the plenary session. Thank you.
Now, these are some of the things that have happened since the last time we convened. Some of the data here is overall health tech, and some of it is specific MedTech. So the health tech, when we say health tech, we mean the digital health space, while MedTech refers to the hardware space. So for the digital health tech, we from our desktop research, we saw that about $65 million has been raised, which was a downward trend. We've already been in this downward trend since 2022. So it dropped again 70%, and we only had that one health tech deals done in the last year. But on the MedTech side, we have some more exciting news, as I began by saying earlier today in the morning, that there's been one main merger, $100 million merger, LXC, which is a hearing aid merger between HearX in South Africa and Eargo from the US. And this was supported by capital from Patient Square. I think this is very exciting for me to show that. And I don't know how comes we haven't heard about this news since April. I think people should be tweeting about it and showing that actually there's an investable asset class here. Yeah. And I'm sure there are many other deals that might be happening in other countries that we are not aware of. The other deal that we read about last year was Hewatele, which was a blended finance. And we're seeing a lot of trend towards blended financing. Hewatele is an oxygen provider, oxygen innovation solution. They actually got grant from Vilgro back in the day, and they went on to raise grant and other blended finance from other partners, including a debt financing from Transform Health, which was a $10 million round to build the liquid oxygen plant. We've also had companies like Irala Health raising $4.2 million in February of last year. We have Revito Health, which raised $4 million. And we also have Modiak. You heard from Ms. Lerato talk about the MPOX and the fast-tracked approval for PCR test. I think this must be one of the innovations that has been approved, and is the first locally made MPOX PCR test built by a Moroccan startup, which is now being rolled out. So these have been some of the trends to show there has been some movement, even though the market has been contracting from the digital health side, but we've seen more activity in MedTech for the first time. It's usually health tech which has more activity, but this time we are happy that MedTech is also gaining momentum. Some of the other trends that we saw in the last 1 year was one, how do you balance regulatory rigor with agency? You heard from Dr. Jeremy about all the constraints around regulatory and how we are trying to solve that with the sandbox. But from the investor side, we're also looking at, because sandbox is not the only solution, right? We have to look at other ways also to look at navigating regulatory challenges, and all these have to work together. And on our side as investors, we are looking at how do you balance rigor with the agency? How do you, for example, show traction through pilots, early purchase orders, even though your device has not been approved? Can we see some early commitments from maybe government of Ethiopia, government of Uganda, saying that if you build this device, we are happy to purchase from you? Like those kind of letters of support are ways you can show, keep an investor excited. Because if you tell an investor it's going to be a journey of 2 years before I get my regulatory approval, the investor will walk away. But how do you keep them engaged and showing them that there is progress even before you get the final market approval certificate, right? And we've seen an example of that with Neopenda, which did some early pilots. Another one that I like is is Che Innovation in the room? I saw them, yeah? Right there. So what Che was able to do is, while they're building a baby warmer, they also have a component of that baby warmer called a neonest. The neonest is more like the mattress or the cushion that is going to go in the baby warmer. So they realize you can sell the neonests, the cushions, to hospitals already that they might have bought other baby warmers, but they didn't have this cushion component. So they are selling those already while they are working on the baby warmer device. So those are ways to just keep an investor engaged, to show that there's light at the end of the tunnel. Otherwise, it can be a very long journey. Imagine doing this for 3-4 years with no revenue. That doesn't excite us as investors. But if you start to show some early traction while working on your regulatory pathway, that's a very smart way to go about it. The other trend we saw was innovators being able to de-risk regulatory ambiguity. As investors, by the way, you don't speak the regulatory language, right? You start telling us about clinical trials, about this, about that. Most investors, this is not their. We talk a different kind of lingo. We talk about cap table, we talk about exits, we talk about valuation, we talk about return on investments. That's our language. So in our dictionary as investors, we don't have clinical trials and these other things. These are the approvals. That's a language that is not we don't feel home with. But how do you, as an innovator, help us to demystify? Yeah. By using language that we understand, but also having even educating us. But also, one thing we said, for example, can we have even a live regulatory tracker where all those things you're trying to get, all those filings that you're putting in, can we have a way that you have an Excel master tracker that an investor can look at with expected decision windows? I can see on this regulatory approval, here is where we are. Here are the other things that are happening in parallel, and I'm able to track that. So demystifying all that regulatory journey. The other thing we saw is blended capital. I know my time is running out, but blended capital, I think that is not new. We've all been doing it, either combining grants, debt, research grants. In fact, we saw during our discussion that one untapped area is the area of research grants or innovation grants within universities. We're not seeing a lot of people tapping on that to build innovations. It's like all the innovations that come from university research, they just end up somewhere there in a publication. But imagine how much far we would be if we were able to unlock that, because there's a lot of money, unlock that with a clear pathway to get to the investors. So that's the other trend we saw. And we at Vilgro, we are trying to do more of that through a partnership with IDRC, where we are funding or we are pairing innovators with academic institutions to work on the joint research. The last one, which was highlighted in the keynotes, is regulatory harmonization, is one key trend that we are seeing that will help us to unlock investments. So I won't take too much time, but I would like to stop there and happy to answer more questions in the panel. Thank you.
So for those that I haven't interacted with before, my name is Katuchi Kasandi. I'm a consultant with the Lemelson Foundation. For this conference, I was leading the market shaping track alongside my colleagues, Miss Will Moyo, who's based at the Boston College and is not available here. But over and beyond that, we had a couple of other people, including Maureen Awar from AMREF, and also we had a team from Hatch Technologies. So with that, I'd like to just walk you through what we've been doing for the past 1 year. So as our MC said, this is the third year of TAMC running. In year one, we had a track around market access. And in the market access track, one of the things that came up was that, like, I click here. Something that came up was that generally a huge challenge that does exist when it comes to market shaping is information asymmetry. So there's a lot of information that for us we need to know to be able to build medical technology locally, but that information sits with a few people. So last year we continued with that pathway to explore what were some of the projects that we could build to ensure that we start democratizing this information. And one of the project proposals that was made at the conference through the market shaping track was for us to proceed and do an ecosystem mapping of stakeholders that are involved in the MedTech ecosystem across the continent. So after the conference, we built out an action plan as the market shaping team. And what we quickly realized was that having ecosystem mapping who are the different stakeholders in the MedTech ecosystem and what they were doing would not be sufficient, just because ecosystem maps tend to be very static. And therefore, there's new information every other day. So someone looking at this snapshot that was created probably in January may not, like, that snapshot may not be relevant in April, because there are new players coming in, there are others who have left the market, etc. So what we decided to do as a track was to prioritize which stakeholder group we wanted to map out and just go deeper. Instead of going wide to look at what different people are doing, get deeper to understand what that stakeholder group is doing. And as a track, we settled for the government with a specific focus on what's the role of government in enabling medtech development, manufacturing, and distribution in the continent. So one of the things that, as we were trying to prioritize government, some of the challenges that emerged for us were that when it comes to local innovators or other implementers in the ecosystem that are working to support local solutions, there's generally a very limited understanding of how government prioritizes and fund medtech. And other challenges that emerged were that, I think this has been highlighted a lot today, is that there's a very complex procurement and regulatory system that often innovators find it as a barrier to engaging with the market, with the government as a market. And thirdly, we also learned that there are the procurement processes the procurement processes for government tend to be very complicated for innovators, and sometimes this becomes a barrier to market entry. So and this one I've mentioned, as a track, we were focusing on government because, as a lot of you have seen or we highlight throughout the conference, is that in the continent, government tends to be the biggest purchaser of medtech. But over and beyond that, government makes a lot of decisions around, national health essential schemes, national insurance schemes that a lot of innovators would like to understand, so that even as they are building their local innovations, they are actually able to align their priorities with the priorities of the government, so that they can be able to access the government as the biggest market in the continent. And then finally, a lot of the government policies around procurement tend to influence the decision-making of donors. They will influence where private sector invests. So, for example, if the government right now says that the priority is on newborn or maternal health, you'll see a lot of investments by manufacturers, donors, private sector towards that. So it's in the interest of innovators to know some of those interests so that they are able to align their innovation with them. In terms of the track, we had a few key goals, but the ones that I would like to mention was that we wanted to create a tool that would enable innovators to actually be able to tap into the existing national health system and innovate around it as they prioritize some of the priorities that align with government. Another key goal was that we also wanted to make sure that we have availability of data that would not only influence investors in their investment decisions and donors, but would also be able to influence policymakers and strengthen their procurement processes to ensure that they are able to align with some of the priorities of the innovators. So what we ended up developing was that we started working on a market landscape. So for the people that will be attending the market shaping track later tomorrow, you will see that for the landscape analysis, we decided to prioritize one country. Initially, we thought we had identified a couple of countries that we wanted to prioritize, a country that was a lot more developed when it comes to the MedTech ecosystem, another one that was a little bit medium developed, and one that was growing. But for the purposes of the conference, we thought that it would be important for us to start with a prototype and design our templates. Then through this conference, we can be able to work with you to co-create, to review the prototype and gain feedback around what information do we need to include in this prototype to ensure that this becomes a tool that you can actually be able to use in your day-to-day work as an innovator support organization, as government, or even as academia that's teaching innovation. And so therefore, tomorrow you'll get to see the Malawi prototype. And in the Malawi prototype, you will get to see like some of the areas that we are mapping within this document include things like what is the government expenditure on per capita expenditure on MedTech. We are looking at what's the process of including some of the innovations in the national health essential schemes or national insurance schemes. Like how often are they updated? What's the process of updating? How can innovators plug into that update process so that they can be able to influence? Over and beyond that, we also wanted to map out who are some of the external funders that are working with governments, what are their priorities, because sometimes these priorities also influence the priorities of the government of the government. So if you are able to know like their priorities for the next 2 to 5 years, then innovators that are innovating around that lifetime are actually able to innovate within some of those priorities. Over and beyond that, I think some of the utilities that we foresee for this is that for innovators, you're going to have like this repository where you have a very clear process of if you want to engage government, these are the different ways in which you can engage. This is a repository that provides all the information in one place to avoid the fragmentation, the information asymmetry that does exist. If you are a funder, then you're also able to leverage this repository to be able to find data that's going to support your decision making, even as you support innovators or you support the government. And for the government, this is going to provide an opportunity for them to strengthen their procurement policies and processes so that they are able to work with the innovators. So the conference, I would say that for the market shaping goal, our conference is our goals for the conference are threefold. So the first goal is, as we mentioned, we've worked on a prototype for Malawi. We want to present this prototype to you and get to co-create in terms of what should we remove, what should we include in this prototype to ensure that this is a document that you can be able to use in your day-to-day work as you work with innovators. Over and beyond that, we also want to make sure that we are, beyond just refining this template, we're also working with you to define what should be the next steps of this Malawi prototype. And over and beyond Malawi, which other countries should we prioritize going forward? And beyond just prioritizing the countries, where do we want to see this project go? Because as a market shaping track, our goal has always been for us to collect enough data so that you can start using some predictability models to make this data smart. But you also want to co-create that with you and hear where you want it to go and how do you want to plug in as an individual and as an institution. Thank you so much. I look forward to responding to your questions and getting your feedback in terms of how we can strengthen the market shaping track.
In the product development track, led by Wamboe Nyebero, who is our former chairperson for the TAMC, myself from Vilgro Africa, and also my other ecosystem partners from KU and a bit of more academic, were able to co-create this with the startups that were able to join us during the post-TMC activities. And some of those startups are already here represented. The aim of the context here was to just be in a position to bring together community of startups, voice their challenges, and merge them with the other tracks. As you can see, we have representatives that have been working on the investment track, regulatory, and market shaping. The essence is to basically align and come up with a MedTech association as our goal, of which we will be creating more in-depth context into it during this conference itself. So my name is Winnie Wangari. I'm the MedTech lead at Vilgro Africa and also been supporting the team on this track. So product development track had focused on creating a comprehensive ecosystem to support the MedTech stakeholders itself, accompanied by several startups, of whom we were able to establish 4 teams within the product development track, which are establishing, our first team was to establish a MedTech association, followed by building a resource platform and also promoting founders wellness team. And lastly, the 4th team was to work on developing a network of mentorship program, of which some of the activities we are able to do over the last year is what I'll be sharing with you. And in the context of everything, when we'll be breaking out into our own track, you'll be able to join us and co-create more context of what we've already created. So the team 1, which I was leading in terms of creating an association, the intent was to actually complete this by today. We were to launch it at this conference, but unfortunately, we're not able to do so. But we've been able to mark some significant understanding of how we could be able to basically establish an existing MedTech association under the TAMC. And within this, we are able to map out all the activities that we promised, which was in the process of building the relationship with other associations, bringing on the effort to reach out to other team completed with having a directory of association, creating a regional MedTech startup that we wanted to invoice all the MedTech into one block within the TMC. That's why the MedTech ecosystem at TMC has been growing year to year. And the year since we started back in 2023. So in this team, we've been able to process the development of the framework for association, including the draft itself, mapping out the suitable country that will be able to register this association. And we've confirmed that the registration will be created. I think this will be a continuation conversation after the conference. The team 2 will now be engaged in developing a web platform, actually being led by one of the startups within the track, whereby they were to create design websites, mockups, including platforms that will be able to host this member directorate. And the members does not include just startup. It will engage the whole entire MedTech ecosystem, including the partners that would like to join us from the investment track, the conversation that Katuchi was able to present on the stakeholders from the market shaping, and the regulatory sandboxes that already started on from Kenya and other countries that already have that. So we'll be able to host that, and the platform will be able now to team up with all those content to be personalized, not personalized per se, but consistent in terms of identifying the gaps and addressing those gaps within the startup ecosystem in Africa. To the 4th team, whereby it was addressing some of the initiatives that the companies or the startups had shared in the last TMC conference 2023 and 2024, which is in the Wellness and Resilience Program. And they came up with a program called Mindful Mondays, which involved designing weekly quotes and engaging with the startup to design a mental health awareness within the startup ecosystem, and having conversations with a couple of partners to be in a position to start this engagement. So not leaving alone a startup to grow the company by itself, but also being mindful of their health or mental health care. The last team was basically the network of mentorship. This was basically to developed a tool called Needs Tool, which was to create feedback from the members entirely, And they were able to identify a couple of development that was structured. And the focus here was to come up with a way in which they could use those expertise in a line with other tracks to be in a position to be accessible and provide the networks in such environment like TMC or any other conferences that they'll be able to avail and see how they could be able to grow the MedTech industry itself from the startup line of things. So that will be all for the product development track, and welcome you all for the other tracks that we'll be able to doing later on. Thank you.
My first question will be for you, Katuchi. In the last TMC, one of the conclusions that was made was that market shaping is the bridge between innovation and uptake. And I really appreciate that the market shaping team went ahead and did a pilot in Malawi. So, if you don't mind, could you give us a taste of the learnings from the Malawi pilot, particularly for the innovators, but also feel free to just speak briefly to what you've learned that might be of benefit for innovators specifically. Thank you.
Okay, thank you so much, Moses. And as expected, I would say that Malawi is not so very different from like the other markets in the continent. So some of the insights that we are seeing are that, I mean, the Malawi market is very donor dependent, but as even as Jagi highlighted earlier, we've been seeing a decline in the amount of donor funding that is going to Malawi. And therefore, there's a lot of opportunity now for us to start exploring what are the opportunities for public finance to leverage the limited available private finance so that we can start to see sustainable and resilient health systems in Malawi. Something else that we saw in Malawi is that, again, the government is very dominant in terms of like, it's the public hospitals that are largely driving the healthcare sector. It's government that's the biggest purchaser. And all this, as I'm saying all this, the thing is that then we can't ignore as innovators, the opportunity for us to try and align with government processes, align with government priorities, so that we might be able to tap into that market and expand. Over and beyond that, we also saw that in terms of like opportunity, there's a lot of emerging opportunity around digital health that would be a great place for innovators to position themselves. And I know I'm not getting so much detail into the detail of the report, because we have a whole session that is geared towards presenting this report and sharing the findings.
Thank you, Katuchi. Moving on to you, Winnie. Last year, in the product development track, one of the learnings that came out was the need to design for African realities, particularly infrastructural gaps around electricity, fragmented supply chains, and gaps in healthcare delivery, particularly like primary care and in rural areas. As the Vilgo Africa MedTech lead as well as the healthcare track lead, my question to you is, what are some of the things that you're doing to address that particular question?
Thank you, Moses. So few of the things we are trying to try and manage those particular gaps, because we've seen that in a lot of companies that we currently support or we don't support. We've seen them through some of them coming through the TMC. is through merging them with the ecosystem players. Yeah. What I mean by that is that if there is the infrastructure insufficiency, we are able to align, or we are able to go ahead and merge with that particular manufacturing hub or a design studio or academia that could be able to provide the resources needed to be in a position to kind of reduce the risk for product development for them. And one of the program that I was able to introduce, which is called the immersion program, in calculating with all these resources that will be required, we've also been in a position to work with ecosystem engineers or ecosystem experts in the room or in the industry to kind of educate and elaborate the best way to resolve those resources or to resolve those issues, whether it's through looking at new design methodologies that could be adaptable to the design so that it can be easily accessible in any low resource setting that they want to serve. So putting in mind as well the issue around having to place themselves in the regulatory aspect in terms of the limitation that comes to it, that knowledge of understanding how to actually build a product that can also meet those regulatory standards is also a way, ideally, that will not make them difficulty looking at how or when they'll be going to market or when they'll be going to regulatory sandbox. Maybe when they'll be joining the regulatory sandbox to kind of implement some of those frameworks that are already in place. Yeah.
Thank you very much, Winnie. And it brings to mind some of the learnings from the work that we're doing in the public sector. The need to really understand the public sector demand. This speaks to your point, Katuchi. But then, on the other hand, leverage ecosystem resources, which is what Winnie, that you're working on as a track. My next question is for you, Wilfred. And in the last conference, we concluded that beyond traditional VC models, we also need to think about financing mechanisms that are African. So we do know that there's been quite a shift in terms of the funding landscape. And so what I'd like you to do is speak a bit to the kind of innovations needed to fill the gaps that have emerged in the funding landscape, and also to work that you are leading as Virgo Africa CEO to respond to the opportunities presented by the shift in the landscape.
Yeah, thank you. So there are a few things we've begun to do. I feel like right now is a time for early stage players to start working together. If you look at all the different people who are funding early stage innovations, we tend to do that in silos, right? We have Rise 360, I know they're in the room. We have UGHE. We have other programs that are also doing early stage, including iShow. So we're saying, can we bring all these together, all these different funders that are looking at from idea to product, very, very early stage, so that imagine if each of us is cutting $10,000, $20,000 check, quite small amounts, but then we're doing that in silos. But if we came together, our 20,000 from Vilcro, another 20,000 from Rise 360, another 10,000 from UGHE, another 20,000 from Rise 360. All of a sudden, the startup can get substantial amount. That's about $100,000. That is enough to take them from idea to an actual functional prototype or a functional product that can be taken for clinical trials. So that's the work we're doing, and we're actually now co-developing a proposal with Winnie that is looking at that specific angle, because I feel like with the resources reducing, we can't continue working in silos anymore. because at the end, it's the startups that suffer. We're giving them too tiny amounts that are not enough to move the needle. So that's one thing we're trying to do. The second thing that we'll be doing very soon after this is if we can get all the email addresses of all the startups within TMC, we have our own funding tracker or a funding hit list that we prepare at Vilgro. Is another resource that we want to avail to TMC startups so they can be able to also apply for those funding opportunities. Thank you.
So on to you now, Professor Jeremy. I've been privileged to attend a previous presentation at Kenya Innovation Week on the work that you've been doing around the sandbox. Now, this work has been focused on Kenya, and since this is the Transforming African MedTech Conference and we have a lot of countries represented here, my question to you is, what are some of the lessons you've learned from implementing the sandbox here that you would share with the rest of the countries represented here in terms of how to put together a sandbox? And in line with that, what do you think of the idea of a continental sandbox that brings all our countries together to address issues at that level? Thank you.
Thank you, Moses, for that question. In relation to the lessons learned from the sandbox modeling project that we've undertook that led us to having a blueprint that we have presented to the regulators and policymakers, is certainly that there is a need for stakeholders within the health sector to have a much more urgent understanding that we need to work together in similar fashion to other economic sectors such as ICT, the fintech sector, where we have seen more willingness by regulators and innovators to work together. I think because the stakes are higher in the health sector due to the fact that we are dealing with human life, in certain instances there is a bit of hesitancy on the idea that regulators and innovators can actually get into a room together and come up with a blueprint of how they can work together to remove the bottlenecks of innovation within the health sector. So it is quite important. But for that to happen, there is certainly need for leadership at the highest levels of government, because that then provides that impetus for stakeholders to trust each other and to trust that they're indeed working towards a common goal, rather than the reluctance that if perhaps we do not stick to our mission, which can either be to put a product in the market as soon as possible, or to ensure that innovators are following the regulations by the book. If that is the mindset, then it is very hard for us to accomplish what we are trying to accomplish with the idea of regulatory sandbox, which is a very different way of thinking about regulatory theory and practice, in the sense that regulation is not about policing innovators that are from the onset, considered as a threat to the public, but rather as regulators and innovators as partners that are championing each other's separate mandates. Innovators are there to shape, to support regulators in their regulatory role, and vice versa. Regulators are there to support innovators in their role. On the second question on the prospects of a continental regulatory sandbox, indeed, this was one of the issues that was also picked up by the innovators in the conversations that we're having. We see that in other regions, including the European Union, we've seen the establishment of, for example, EU regulatory sandboxes under the European Union AI Act. We've seen continental regulatory sandboxes in other sectors such as fintech in other continents. And so this tells us that we should indeed start working regionally and using the current policy and regulatory frameworks, for example, at the East African community level. I know we'll be talking about this tomorrow in some of the panels we'll be having. We have frameworks that are already in place to promote more collaboration between regulators and policymakers within the innovation space generally and specifically within the health sector. We need to use these as stepping stones, of course, in addition to the AMA that has recently been passed and has been assented to by a good number of the East African community countries, the continental listing that we also see as an opportunity for enabling innovators to, broaden their national markets continentally, and quite importantly, even the African Continental Free Trade Area that is promoting the idea that we are one market, championing the economic development of the continent as a whole. So we certainly need to work towards a continental regulatory sandbox that broadens the economic markets for our innovators. But we will, of course, be talking about this more in the regulatory tracks this afternoon and tomorrow. Thank you.
Thank you very much, Professor. I want to go a bit off script. Dr. Manya, when he was here, made a very interesting point that when they are approached as government with innovations, one of the questions they ask is of funding. How will this be financed? All right. And that really resonates quite a bit with what I see in the public sector work, and not just in Kenya, but in other countries where we are working. So at this point, I want to ask the panel, and then after that, we go to the audience for ideas. So, Katuchi, you said that government is the greatest source of demand. So on the one hand, we have government telling us that there are funding gaps, but on the other hand, we are finding that government is the greatest source of demand, so we must target our innovations at government. So this is open to any of you here. What thoughts do you have about how we can address that dilemma? Let's hear from you and then we can go to the audience. Thank you.
Thank you, Moses. I'm happy to go. Here I'm wearing my hat as a consultant for the Lemelson Foundation and the leader for the Kenya Innovation Ecosystem Funders Forum, a forum that brings together 11 grant makers that have aligned their funding mandate around the Kenya Innovation Master Plan. So one of the things that all the funders within the Kenya Innovation Ecosystem Funders Forum are seeing is that a lot of them, their funding is coming from other governments, so they are bilateral partners. And if their budgets were not shrunk this year, they'll be shrunk next year. So now more than ever, even for them to actually be able to achieve the work that they need to achieve, they need to work with other partners. So one of the conversations that you're having at that level is what are the opportunities that exist for public and private capital to work together to be able to increase the capital flow for homegrown innovations in the market. And one place that we intend to start this is we are having an AVPA conference coming up this year. And at the conference, we are bringing together something that Wilfred alluded earlier, national research funds, science granting councils that tend to have funding to support R&D for homegrown innovations. But for most of them, they've not leveraged that funding to unlock funding from the private sectors. So as foundations, as development finance institutions, we are looking at other governments in the continent, like, for example, Ghana through the Ghana Venture Capital Trust. Zambia, also the government of Zambia has set up a public-private sector fund of funds to unlock more funding for local innovators. We are seeing this in Nigeria. So we are trying to explore learning from lessons from other countries that are leveraging, even South Africa with TIA, Technology Innovation Agency. They've leveraged public funding to unlock private capital for invention and homegrown solutions. So how do we bring those public-private partners that have worked together to support or to unlock or to drive more capital flow to SMEs into a room to be able to showcase models that are working, and from that opportunity explore what's the opportunity for other governments beyond this. And now for us as the network, given that we are more interested in like research to commercialization, invention, etc., what's the place for National Research Fund? What's the place for science granting councils? What's the place for innovation agencies that have a funding to leverage that capital for more? So that's one of the things that we are exploring as a network of funders.
Thank you. Professor Jeremy, allow me to throw this your way, because the last point you made was around economic potential in the MedTech sector, which seems like it might be a carrot to encourage government to invest. So back to this question, how do we address the dilemma of the funding issue? Thanks.
Thank you, Moses, once again. I think when we look at the trend of government involvement in innovation, especially these frontier, emerging innovations such as AI, etc., in developed countries, including in the US, we see that the governments have realized that they actually need to have more skin in the game. We are seeing more investment, more direct investment, and even direct ownership by, for example, the US government when it comes to AI development. And this is because of the concerns relating, especially when we are talking about digital technologies, concerns relating to digital sovereignty, data sovereignty, control of these really sensitive technologies. Of course, there are different motivations, including, for example, developed countries like the US that actually want to dominate, and that's why they are investing in and having a direct stake. I believe the US government has even bought a stake in Intel recently. So in the context of Africa, it's important for government to also look at funding, direct funding, and even a direct stake in through the public research institutions in these public health innovations that hold sensitive data relating to the citizens, etc. We've had instances where private funding from abroad, the terms that come with this funding is that the data of the citizens is owned by those foreign funders, which is a huge public health and, of course, privacy concern. So in this context, in as much as, yes, we are talking about the economic imperative, there is also the public interest imperative of being able to be in the driving seat of shaping how our health sectors move forward. And it is only when when our governments are in the driving seat of being able to shape our economic sectors that we can indeed now talk about the economic potential of these sectors and the need and the government feeling like indeed our investments in these sectors are not just going down the drain. It would be important for us to even rethink our intellectual property policies. so that they promote not just private sector investment in health technologies, but also public sector investments. In instances where if government holds intellectual property in certain health technologies, it means that they are then better placed to safeguard the interests of the public. So indeed, I think that it is an important agenda at the moment.
So, ladies and gentlemen, thank you very much. I think just to conclude, I really like the way this conversation is ending. But just to note that it's the purpose of this panel was to stir interest in the panels, rather in the different tracks. And I think an insight, I like really what Professor you said about the idea that governments have not just an economic but also public interest imperative to get involved in this innovation space, and that as we think about regulation, perhaps we should create room for governments to get a stake in this early stage innovation space. And I think that's really a brilliant idea and a good way to close this panel. So thank you very much, ladies and gentlemen. I'll hand over back to our MC, Watau, and see you all in the different tracks. Asanteni.